Coronary steal is diversion of coronary flow from one artery to another. Coronary steal can be either from one coronary territory to another or from a coronary territory to a non-coronary territory. Different such scenarios can be found in literature. Abnormal stress test due to large anomalous vessels supplying a large left atrial myxoma producing coronary steal has been reported. Symptoms and abnormal stress response resolved after resection of the tumor and ligation of the abnormal vessels. Another situation is coronary steal into a coronary cameral fistula connecting a coronary artery branch to the left ventricle. Rupture of a coronary artery aneurysm into the right atrium in a patient with systemic lupus erythematosus and sepsis resulted in inferior wall myocardial infarction due to coronary steal. Angina and positive stress test occurred in a patient with a fistula connecting left anterior descending coronary artery to left superior pulmonary vein. Coronary steal and ischemia can occur due to a patent side branch in left internal mammary artery to coronary artery bypass graft. Coil embolization of the Lima side branch produced relief of coronary steal and ischemia. Multiple coronary microfistulae into the ventricles due to persistent Thebesian veins is another rare cause of coronary steal. These cases are not amenable to any surgical measures but respond to usual anti-anginal medications other than coronary vasodilators. Coronary vasodilators can theoretically worsen the coronary steal phenomenon. Coronary steal can occur in post-CABG patients with the Lima graft if the subclavian gets occluded. A post-CABG patient who had Lima to LAD graft and bilateral carotid artery subclavian graft occlusion presented with non-ST elevation myocardial infarction. The patient was successfully treated with endovascular procedures in the cardiac cath lab. Here are the initial set of references on coronary steal. Here are the remaining references. Coronary subclavian syndrome is the diversion of blood from the coronary circulation to the exercising left upper limb after a coronary artery bypass graft CABG using left internal mammary artery Lima. This occurs when there is a high-grade narrowing or occlusion of left subclavian artery before the origin of the left internal mammary artery. Though it is a rare situation, it is a serious threat to the success of CABG. Coronary circulation is the blood flow to the heart. Left internal mammary artery is the blood vessel to the chest wall. Subclavian artery is the blood vessel to the upper limb. Due to the steal, blood supply to the heart muscle may not be sufficient and it could produce chest pain, heart attack, heart failure, or severe abnormalities of heart rhythm. Narrowing of subclavian artery can be suspected when there is a difference in the blood pressure between the two arms. If there is a difference of more than 10 millimeters of mercury between the two arms, an angiogram of the subclavian artery can be done along with coronary angiography. Coronary angiography is the test used to detect blocks in the blood vessels of the heart. It is done by injecting radiocontrast medications to the blood vessels of the heart and obtaining continuous X-ray imaging using specialized equipment in a cardiac catheterization laboratory. Exercise stress test by hand grip of the left hand is a useful test to document coronary subclavian steal syndrome. Awareness of coronary subclavian steal syndrome in those who have undergone coronary artery bypass surgery is important as the symptoms can be variable. It causes a functional graft failure if there is significant narrowing of the initial part of subclavian artery. Screening for narrowing of subclavian artery by checking blood pressure in both arms has been recommended prior to CABG. If narrowing of the subclavian artery is detected, it can be treated by either surgery or angioplasty before CABG with excellent long-term results. In those who have symptoms, both surgery and angioplasty give good relief of symptoms. Angioplasty is removal of blocks using small sturdy balloons attached to the tip of small tubes known as balloon catheters. They are introduced through the blood vessel under continuous X-ray imaging.